If you've been wondering what grip instructors have been up to, I've got some news for you. We've had a pretty busy summer so far. Back in June, I taught for two different companies. One was the Academy of Shockwave Excellence in Georgia, and I was there teaching a one-day course on our non-surgical knee replacement. And we followed it up in Texas at the Cairo Texpo convention in Frisco. We did a little 4-hour version of our non-surgical knee replacement and a 4-hour version of our non-surgical hip replacement. Those two places have been mainstays for me. So if you'd like to catch me in Texas, I'll be at their next Texpo next year in 2016. But I'm also doing the tour of Texas. So I'll be in Tyler, Texas this fall in October. And in the spring, I'll be in McAllen, Texas, doing one-day seminars for the TCA. And then we'll come back and bring a full grip course to Texas. Let me know if you're interested in Houston or San Antonio. Those are the two cities that we're looking at. I'll also be teaching again for the Academy of Shockwave Excellence in I believe it's a free webinar. If you already have purchased equipment through Kinos Medical, I believe you're invited to this free webinar. It's later this month in August on the 27th. I'll be doing a 30-minute webinar on radial and focused shockwave therapy with some Q&A afterwards. I'll also be presenting in Boston this November. We're going to be doing the Cairo Congress in Boston. So this is the executive directors of all the state chiropractic associations. We're going to give them a little demo of what we do at conventions so that we can branch out and meet more of you in person. So those are a few events that we have coming up outside of my clinic here in Chicago. But of course, we've got an exciting one coming up here in September. Let me get those dates for you here. We're going to be teaching a one-day experience on the non-surgical hip replacement. And that's going to be paired with a 2-day course on our classic grip clinical spine series. So that's going to be September 19th through the 21st in Chicago. We have CEUs applied for and ready for Illinois chiropractors, Michigan chiropractors, Indiana and Missouri chiropractors, as well as Florida. So you can come in and take our one-day specialty course, the non-surgical hip replacement, our 2-day grip clinical spine, or come for all 3 days and hang out right here at Cornerstone Health. So in other news, I've been trying to teach my daughter how to ride a bicycle. We're a big biking town here, and she's okay with training wheels, but she's having trouble going fast and finding the balance, and it's a process. If you've been there, you know. And my neighbors gifted me this tag-along bike that clips onto the back of my bike, and we got that all set to her and gave it a little freshen up on new handles and new paint. And now we've been going on rides for about a mile around town, and she tags along behind me, and it's been cool. I've been doing the balancing, the steering, and the braking, and I've been letting her do all of the pedaling and deciding which way we go. And she's getting a hang of how to operate in a busy town, how to be safe, when to pedal, when to stop. And it's been a really fun experience. And it got me thinking a little bit about the mentorship experience and how we try to do things both with grip as well as in general here at the clinic at Cornerstone Health, because we are a teaching clinic. We have other providers come into shadow. We have preceptees from different programs come in to learn, but also work with us. And a lot of that experience is sort of like the tag-along bike. At first, students are watching something that they want to be able to do, watching somebody ride a bike and conceptualizing it. Then we have some options. We can either throw them on their own bike, with some training wheels. So throw them into some cases. I'm the training wheels. I'm here for them to bounce things off of. And for the right person, they can pick that up right away and go with it. And they might not even need the training wheels. Those might come off really quickly. But for a lot of people, this kind of tag along bike option is better, where I'm still the driver. I still decide kind of when the case needs to go faster, when the case needs to stop, how to keep the case on track. But we allow the students to do a lot of the pedaling. They'll be doing the hands-on therapy, leading rehab, managing case questions. But it's a partnership. It's a tag along, and then we go from that to the training wheels and eventually, riding the bike along. So I think ideally for our preceptorship program, that's what we see with our students. They come in and they observe. Then they tag along and we give them parts of the case for them to be in charge of, to pedal. Then they go alone with me still being here as training wheels before eventually they're just riding a bike and not thinking about it. And those are the ones that become associates. So anyway, having a good time with my daughter riding bikes, also having a good time with our preceptors here, kind of building them up to be great providers for the future. I think it's a model that you can take and implement. I know I had a couple questions from other DCs, like how do you run a preceptorship program that's good for the clinic, good for the patients, and great for the students. And that's some of my mentality of how I run it. Okay, I want to give you a business takeaway. This has been a new thing for us. We have started, I feel crazy about this, I've started doing some paid ads. And as a solo provider initially and being good at organic growth, I never thought about doing paid ads until about 2 years ago, kind of like that tail end of the pandemic. Our numbers were okay, but we no longer had a wait list, which I'm accustomed to having a bit of a wait list. And I wanted to bring more great people onto our team. And anytime you grow, you need more people in. And we first tried some paid ads at that point, and I thought it was a total bust. I paid money. I don't think I got good results for it. And ultimately, it was just more money out, not more money in. And it made it hard for us to grow to more people in our practice, being able to help more people. But on the flip side, I started with a new company, and they've brought in some good people for us to help. People that specifically needed what we do here, which is provide a viable alternative to joint replacement. So those are the people we want to be in front of. And getting them in the door is just one step. Nurturing them through that process of being a cold lead on Facebook to somebody who knows they're in the right spot and they're ready to commit to everything it takes to get better, that's kind of the art of the whole process. Otherwise, it's not going to be worth it to use that expenditure on ads. And so we've had some experience with this. And I want to give you just a little takeaway of what I think is maybe the two most important parts of that process. That list is probably longer, but let's go for two today. The first part is to really agree on what we're trying to accomplish. And that might sound simple up front, but that needs to be an objective goal. So it can't be a reduction in pain. A reduction in pain is not a goal that I can measure. It's completely reliant on what the patient represents or tells us. It needs to be something objective, like a patient that came in via this cold marketing lead earlier. He worked his whole life as a restaurant server. He's in his 70s now. He's had to quit the past year because he couldn't stand or walk due to his knee pain. He can't walk around the block with his friends. And he's tried some joint injections with PRP. He's tried some joint injections with cortisone. It's not getting better. And we had to really sit down and say, what does success look like for you? And we defined it. He wants to go on a 1 mile walk with his friends without having to worry about it. And he wants the option to go back to serving tables, waiting tables, which is a 4-hour shift. So those are measurables for us. Now, if we're in agreement that a success is 1 mile walks without issue and 4 hours of standing without issue, and we both agree on it, now we know exactly what we're working for. And we can set up the right plan for that, and we can have the right value attached to that in terms of what's reasonable to spend on achieving that goal. So that's one. We do that for all patients, whether they're coming in on a referral or a past patient, or in this case, in these cold leads. So really define objectively what you're both working for. I think the second thing is, okay, let's simplify it. The second thing is to get out of your own way in terms of cost. If you are going to be recommending a type of care, let's say this particular patient, I recommended 16 sessions with him. So I'll work with him for 8 weeks based on what his goals are. And I'm going to include some things like radial and focus shockwave therapy, rehab, everything that I think he needs to get to those goals is put into a plan. And that plan has a total. It costs X. And we want to make the delivery of that discussion as simple as possible. So in this case, we'll call him Frank. Frank, to get you back to walking a mile and standing for 4 hours, it's something that we can do, but we need to act on this now because the degeneration in your right knee is moderate. It's grade 3 already. So we need to act now on that. So that's sense of urgency. We're going to need to work with you for 8 weeks. Everything that we're going to do for you is included in this quote. The cost to you is, I'll just say X. The cost to you is X. And then stop. Get out of the way. Don't hesitate. Don't go through what the discounts are. Don't go through what your insurance is going to do. Don't immediately say, but we can put you on a payment plan. Just let them know. Bottom line, it's going to cost you this amount of your dollars to get these results. And then stop and let it sink in and let them decide whether or not they place that same value on getting better as what you've outlined for them. A lot of times they have. A lot of times getting better is worth more to them than that dollar amount. But if it's not, they need to either A, reconsider what the value of getting those lifestyle factors back is to them, or B, they need to say, hey, either this is not realistic for me, or I need to change something with my own finances to be able to get to it. And they will bring that to you. Now, what you do after that is totally flexible. You can cut a plan in half and say, let's do half now, half later. You can do a la carte, one at a time. But I think the most important thing is to not shortcut yourself. And I used to do this all the time. I didn't want to tell them exactly that you need 8 weeks and it's going to cost X. I wanted to say, each time you come in, it's going to cost Y, and that's a smaller number. But the problem is when you do that, you're not really asking them to commit to do everything it needs to get those great results. And I'm stubborn. If somebody comes and works with me, I want to guarantee a certain percentage of results. And if they're not going to do their part, and if they're going to drop out early, that either drops my stats or they're an outlier and I can't use them for research. That's impersonal, but the bottom line is I want them to get great results, and their commitment needs to be for those 8 weeks. It needs to be the types of treatment that are going to get them better. And if I start talking that down before I give them an option to say yes, I'm requiring myself either to perform a miracle with less resources or to sell every single session what they need, versus selling once, getting them exactly what they need to know day one and letting them say yes, or letting them say, I need to find a way to pay for this, or letting them say, no, I don't want this enough to go through 8 weeks of care for X dollars. So yeah, bottom line, one, identify what you're working for, and two, just say the price simply and get out of the way. So I hope these pointers are helpful for you. We go through some of these in our typical grip classes, and then we'll send out a couple more videos like this to build up your business practice and let you know about what opportunities there are to join us for a class. So hopefully this was helpful. Reach out if you're interested in opportunities to attend a grip class or see me speak at a convention, or if you have questions about what we discussed with preceptees or that simple sales process.